Hello everybody, my name is Ashley Higgs. I'm a BSN student, term 4. Today I'm here to do a presentation on a teaching topic that we had to research. To tell about myself a little bit, I graduated nursing school in 2013 here at FSCJ. Decided to go ahead and get my BSN because that's needed everywhere. And I was working at St. Vincent's, but I just accepted a position in the NICU at Shan, so I start next week. So, yeah, thank you. All right, so catheter-associated urinary tract infections is a common preventable problem that you see in the hospitals, and they're very on top of this topic. So, let's see. The purpose of this presentation is to educate associate degree nursing students of this common preventable hospital-acquired infection. We are going to discuss nursing interventions that can decrease the rate of infection. Some objectives that we're going to be covering describe 2 recommendations from the CDC guidelines to prevent catheter-associated urinary tract infections. I'll also cover 2 indications when a catheter should be used and 2 inappropriate uses. Also, I'm going to identify where the indwelling urinary catheter bag should be placed at all times and how often the bag should be emptied. So, what is an indwelling urinary catheter? Can anybody tell me? You got it. A Foley. Also known as a Foley, yes. So the definition that I found of an indwelling urinary catheter is a drainage tube that is inserted into the urinary bladder through the urethra. It is left in place and is connected to a closed collection system. And there's a picture of that. I'm sure we all have had that opportunity to place one of them, or even in the simulation lab. And here are some definitions for you. A urinary tract infection, also known as a UTI, is an infection involving any part of the urinary system, including the urethra, bladder, ureters, and kidney. A CAUTI occurs when a patient who had an indwelling urinary catheter in place at the time or within 48 hours prior to the infection onset. So what causes a CAUTI? There are several causes. Bacteria or fungi enter the urinary tract via the catheter, contamination upon insertion, drainage bag not emptied often, there's backflow of the urine from the catheter bag into the bladder, the catheter is not regularly cleaned. Here are some of the symptoms of a CAUTI. The urine might be cloudy, notice some blood in it, has a strong odor. You might notice some leakage around the catheter. The patient might complain of pressure, pain, discomfort in the lower back or the stomach. They may have chills, fever, be fatigued, vomiting, changes in their mental status, or confusion. I noticed that to be a big one, the mental status. When you notice like they're not acting right, that's the first thing I usually do is like, hey, can we get a urine culture? Statistics on CAUTI, one of the most common hospital-acquired infections. They account for more than 30% of healthcare-associated infections. 25% of hospitalized patients are catheterized yearly. 10% of them develop urinary tract infections. Around 500,000 CAUTIs occur annually in the United States. That's a lot. They can also lead to many more complications, including morbidity, mortality, and increase of medical costs. So with this, each CAUTI is associated with the medical cost of about $758. A total of over $3,400 million spent in healthcare is attributable to the incident of CAUTI in the U.S. each year. The increase in hospital costs impact the payment that is actually provided to the hospitals for CAUTI treatment-related costs. So what can we do as healthcare providers to prevent and decrease the ongoing rate of infection? So first we need to know when is it appropriate to even use a catheter. Here are some of the indications for the use. For a urinary tract obstruction or retention, which I see that usually a lot. Neurogenic bladder, a urologic study, surgical procedures. A lot of the urologists will actually place these catheters too. It just depends on the situation. This is a tricky one, stage 3 or 4, like a pressure ulcer on their buttocks or something. Sometimes the doctor may feel that it's necessary to place it, but I don't see it that common. Hospice, comfort care, palliative care, prolonged immobilization, if they have some type of pelvic fracture or spine. ICU only, aggressive treatment with diuretics or fluids, need for accurate measurements in critical ill patients. Some inappropriate uses. Some people use it just for a substitute for nursing care, they're incontinent. They don't feel like cleaning it. It's convenient for them, so they're just going to place a catheter. You can't do that. Some people, they need to collect a urine culture or for like a diagnostic test or something like that when a patient can't void. So they're like, just go ahead, I'll cath them real quick, get that urine, sample and send it down. You can't do that. Also for prolonged postoperative duration without appropriate indications. So prolonged effect of epidural anesthesia. So there's proper insertion and maintenance techniques. It all begins with hand hygiene and sterility. Proper hand hygiene immediately before and after insertion or manipulation of the catheter device or site. You should always use aseptic technique and sterile equipment during insertion process. The use of sterile gloves. So I have a video. I know I asked some of the students earlier. I had a set of sterile gloves here, but you guys have all done that in first term. I'm sure you're aware and have done this before. Okay. I don't know if it's going to let us play. That's okay. There are proper insertion and maintenance techniques. You need to maintain unobstructed urine flow. So the catheter, keep the catheter and collecting tube free of kinking. So sometimes when it's hanging down, just make sure you follow the cord and make sure that it's completely intact and not kinked at all. The main thing is keep the collection bag below the level of the bladder at times. I know when changing a patient, sometimes you put the bag up on the bed, but then you forget about it. I mean, it's easy to do because you're in a rush. But it always needs to be down at the bladder at all times, or below the bladder at all times. But do not place that bag on the floor. It can just there's a lot of things that can happen to that. Empty the drainage bag at least every 4 to 6 hours or 2/3 full. I noticed a lot, our aides get busy too, and they'll just let it keep on going. And it should be tracked every 12 hours. So whatever happens on day shift, you should record that. Whatever happens on night shift, record that. But if they're putting out a lot of urine output, then it should be empty when it gets 2/3 full. And also maintain appropriate catheter securement to prevent urethral irritation. I brought a example of what's called a stat lock. So this is a device, I'm sure you've seen it, that it will actually go on the patient's leg to help pull that catheter. If you want, I mean, I don't know if you want to pass it around or anything, but you can clip it on and off. Proper education and documentation is also necessary. Education includes periodic in-service training regarding techniques, insertion, maintenance, and removal. When you're documenting, I know sometimes in the hospitals at St. Vincent's, we actually had a sheet, and you would put the date, the time of insertion, who did it, why, what was the indication, why are we keeping it? I know that we make daily rounds every single day. What is the use of this? And then the date and the time of the removal. And there is a place now in the electronic medical records that you can actually place that information as well. Again, here's just like what I was talking about, the Foley catheter tracking sheet. That's an example. And then I just have a did you know that every additional day of urinary catheter use increases the patient's risk of developing an infection. That's a huge deal. So in conclusion, always assess the need for a urinary catheter daily. Use proper insertion and maintenance techniques. Attend periodic educational sessions, and don't forget to document details. Those are just my references. And then I'm going to pass out these two forms. These are some handouts. This one here is actually from the CDC. It's frequently asked questions on the catheter-associated urinary tract infections. It's actually a really good resource to go back to. And then this handout here is just a tip sheet on preventing urinary tract infections. It's always handy to keep these, as you're beginning your career as a new grad. If you want, you can just pass those around. And then last but not least, I just have a quick post-test, just a couple multiple choice questions, 5 of them, and it's one true false. And attached to it also is an evaluation form, just to evaluate how I did today. If you wouldn't mind just filling those out for me, and then just returning them back to me. Thank you so much for listening to me today.